Hello everyone, I'm Dr. Shields and I'd like to welcome you to Adult Gero Acute Care 2, Nursing 7039. I'm going to go ahead and review some key points in the syllabus for you. This is an asynchronous web-based course. Just make sure, comprised of 3 hours of content twice per week over 7 weeks. So this course will have a maximum of 6 hours of content to review each week. Contact information, if you'd like to reach me, you can reach me by emailing me, and we can just set up some office hours via email. My office hours are available by appointment. So if you need to meet with me for any reason, please email me and I'll set a time to meet with you virtually. The next section is the catalog description, and if you've taken any of the Adult Gero courses, you'll see that they are divided into systems, and for this course it's going to be divided, the content areas we're going to look at and study are neurologic, endocrine, hematology, oncology, infectious disease, sexually transmitted infections, ears, eyes, nose, and throat. Next are the course learning outcomes and objectives. You can pause here if you'd like to read through these. Course materials. So there's going to be 2 required texts and up-to-date that you're going to need for all 3 of your courses. So these will be the only required text for all 3 of the courses and 3 of the practicum courses, for a total of 6 of the Adult Gero Acute Care courses. And the first one is the Thomas Barkley Practice Considerations for Adult Gerontology Acute Care Nurse Practitioners, and you have to purchase it here on his website, and it's only available electronically. The next one is the Papadakis, and this is the 2024 edition. And if you have an edition that is a couple years earlier, it probably will be just fine. But if you're buying one, certainly buy the most current edition. And the third, the up-to-date, this is provided for the MSN students at YSU. If you have not subscribed to this, please email me and I'll send you the subscription information so you can get this platform. Assignments, there's going to be 7 online quizzes. So each module, you'll have a quiz. Quiz 1, obviously in module 1, quiz 2, module 2, 3, 4, 5, 6, 7, and each of those quizzes are 10% each. So the quizzes are 70% of your total grade, and the quizzes are 25 multiple choice certification style questions. So certification style for Adult Gero, there are no multiple answer or select all. So I have very few, actually none, of those types of questions. So these are all the certification style. There is a 30-minute time limit for all online quizzes, so 25 questions in 30 minutes, and all quizzes are due by Saturday at midnight of the appropriate week, and you can see the schedule below. All students are required to have a computer with a camera and a microphone for testing purposes. No exception. All quizzes will include a lockdown browser and respondents' capabilities requiring video and microphones to be turned on. You should be familiar with this already in some of your courses, and there are instructions below at the end of the the syllabus. The next part of your assignments and assessments will be a PowerPoint presentation, which will be 10% of your grade. There's a rubric and topics that are attached. Students will prepare a PowerPoint presentation related to eyes, ears, nose, or throat, and it's a topic that's assigned to you by me. The topic will be presented to the class via PowerPoint. Student is to provide an 11-slide voiced over PowerPoint over 4 to 6 minutes on your assigned topic, and please stay within the 4 to 6 minute time frame. There's many PowerPoints that have to be viewed, and all the information that you need to know on these topics can be delivered in this time frame. These will be recorded by you and will be posted by the end of week 5 so that all the students may view it at their leisure. Please post the discussion board in module 7. All students are responsible for commenting on all of the presentations with either questions, comments, feedback, personal experience, or declaration of something new learned by the last day of the course. All students are responsible for all material covered on the student PowerPoints, and that is what's going to be included as your content on quiz 7. So quiz 7 topic area is the ears, eyes, nose, and throat content. Please post a PowerPoint for the students to print and a PowerPoint for the students to view with a voiceover presentation included. And these are some instructions for recording if you've never done one before. And this is a breakdown of how I want your slides to be. So systematic approach to disease for adults across the lifespan in each of the areas listed below. Your first slide is going to be a title page, and please put the time of your presentation on the title page so we know how long this presentation is going to be, and be sure that it's between the 4 and 6 minute time frame. The next slide will be the definition of the disease. This is going to be your third slide, the etiology, incidence, and predisposing factors. Symptom presentation is your next slide. The next slide is H and P. Next are differential diagnoses, then diagnostic and lab findings. The next slide will be therapeutic plan and management. And if you need 2 slides here, you certainly can add an extra slide in this area. Sometimes for some topics, you may need another slide. Remember, we're only looking for pertinent information, not gory detail. Next slide is when to refer this patient, when to admit this patient. The next slide will cover geriatric considerations. And then your last slide should be your references. And you must have 3 of the 4 references. So a total of 3 references, and the references include the Barkley, Papadakis, up to date, and another scholarly reference. So 3 of these 4 right here you need to have as a minimum. Presentation 4 to 6 minutes, and students knowledgeable on the topic, not reading slides. Nobody wants to just hear you read your slides. So put just pertinent information on your slides and then explain them so it's interesting and people can go ahead and take notes and learn your content. Students need to respond to all other student PowerPoints and follow all the instructions. So this is how your actual PowerPoint will get graded. Here's the rubric for your presentation, each one of the slides, and some of the content area is worth half of a point and some is worth a full point for a total of 10 points. And then the third content area where we're going to cover for assignments and assessments are case studies, which are going to be on the discussion board, and there's 5 of it, and they're 4% each for a total of the remaining 20% of your grade. Students are expected to read course material, to contribute to discussions, and to participate in all case studies. All case study posts are due Wednesdays by midnight. All peer replies are due by Sundays at midnight of the appropriate week. And then this is what the rubric includes. So those case studies will be graded in 5 main areas: 1, quality of post; 2, relevance of post; 3, response to peers; 4, timeliness; and 5, writing mechanics. So as far as some main things that are included here in the quality of posts, so this is something that I want you to have at least 1 scholarly reference to support your opinion of how you're answering this. And please only use Barkley, Papadakis, or Up to Date as your reference for the case studies. There's no other alternate reference, just these 3 right here. And your posts are at least 200 words. This is your original post. The relevance of the post would be next. The response to peers: respond to at least 3 peer postings per each discussion board. Replies are respectful and shows insight and analysis of original posts, and these are at least 100 words per response. Timeliness, you need to have it by the due date, and then writing mechanics, spelling, punctuation, and grammatical errors should be none. So go ahead and take a look at that each time you do your case study post. Attendance expectations: students are required to view all the learning content and participate in all the learning activities by the expected due date with a final passing score of 80% to pass this course. The student must have a grade of 80% or better to satisfactorily pass this course. You are used to, in other courses, this being 70%. For all 6 of the Adult Gero courses, the 3 theory courses and the 3 practicum courses, you have to have a minimum of 80%. Or you cannot, you have to repeat that course. And there's really only 1 opportunity to repeat the course. And if you have any more questions, you can certainly email me. And this is all stated in our MSN handbook with our policies. If an 80% or better is not achieved, the student will be required to repeat the course. Grading scale, kind of just what I went over, 7 quizzes at 10% is 70%, PowerPoint presentation 10, 5 case studies at 4% are 20%, and I want you to put up a photo by your name on Blackboard so I can see what you look like. And so when I'm corresponding with you, it just is very helpful for me. And that's just pass fail, but get it up, go ahead and put your photo up as soon as you can. Instructions are in the first announcement for week 1. So that does have to be done to pass the course, but there's obviously no grade connected to that. The grading system, 90 is an A, 80 is a B, and 70 to 79 is a C. So again, you must have an 80% as a minimum score. This is your course schedule. So it's divided into this first column, the week module, 1, 2, 3, 4, 5, 6, 7. Your topics are going to be neurological, endocrine, immunology, hematology, oncology, ID, STIs, STDs, and EENT. So these are going to be all the content over the next 7 weeks. You can see here module 1 case study, module 2 case study, 3, 4, 5. There's your 5 case studies. Week 6 does not have a case study. Week 7 does not have a case study. So these case studies are on your discussion board. And then you can see your quiz, quiz 1 neurologic, quiz 2 endocrine, 3 immunology, 4 hemonc, 5 infectious disease, 6 STDs, and 7 EENT. Those are your quizzes, and then your current due dates are in the third and final column. This is your PowerPoint presentation topics, and I took the names out, but there will be names here. Wherever your name is, that's going to be your EENT topic that you will discuss. Below that are university policies. If you'd like to click on any of these links, you can go ahead and do that as well. And I'm not going to read all this at the bottom, but this is the graduate school grading scale description. Tells you what an A, B, C, D, and an F is. If you want to just pause and take a look at this right now. And then this is some more policy, graduate school grading policies. Students may receive no more than 3 C's in the graduate nursing program, and you must maintain a GPA of 3.0. A grade or DF must be repeated 1 time before progressing in the program and must maintain a 3.0. And there's another policy, but for the 6 AGA-CNP courses, a C would also need to be repeated for those 6 courses. And if you have any questions on those, everything is spelled out in the Graduate Nursing Student Handbook. And you can look in the College of Graduate Studies for further information. And this rest of the information in the syllabus is just instructions on the lockdown browser and webcam requirement. This can be helpful if you haven't gotten that set up yet. There is a respondent's practice test that I would recommend that you take prior to taking any of your quizzes, just to make sure that it's all set up and ready to go on your laptop. And again, welcome, and email me with any questions. Thank you.